It's my pleasure today to share with you our research on designing for emotional well-being, integrating persuasion and customization into mental health technologies. In recent years, the smartphone has become a portal for managing personal health. Many people are now using mobile devices to track health metrics, access health services, and get personalized suggestions from the systems. However, scholars have raised concerns about the persuasion and nudging from technologies. They argue that persuasive technologies may undermine users' ability to reflect on their situation and decide upon appropriate action. In response to these challenges, HCI scholars have increasingly emphasized the need for customizability and flexibility in mobile health technologies. Studies have found that user customization can increase users' sense of control and support autonomy. Yet customization requires much user effort, and this can be burdensome for people with motivational and cognitive challenges, such as with those with depression and anxiety. It's unclear how this group of people interact with customizable technologies and their desired level of customizability. In this study, we ask, what's the optimal level and type of customizability in mental health technologies? In this research, we present the Intellicare platform, a suite of mobile apps that help people manage their depression and anxiety symptoms. This platform includes 12 individual apps, each targeting a specific behavioral or psychological treatment strategy. The apps are highly customizable and interactive, and users can adapt the apps to their own conditions and needs. And you can find more details about this platform in our paper. We conducted interviews with 32 Intellicare users to understand their experience with the platform. We asked for their feedback on a variety of things, and we were especially interested in understanding how app suggestions versus user customization were most helpful. In the interest of time, I won't go into the details, but only highlight a higher level theme from the findings, which is the idea of human-AI collaboration, in particular, the integration of system personalization with user customization. So personalization is most helpful in providing context-aware suggestions tailored to users' skills level, their locations, and social context. And this can be easily achieved by passive sensing and machine learning techniques. But the system may not know users' physical and mental capacity. A few users said they were partially disabled, and receiving exercise suggestions from the apps made them feel like a failure. So the apps needs to ask users to report their physical constraint and provide tailored suggestions. And similarly, personalized suggestions should also consider users' motivational and mental capacity and not suggest activities they can't perform. This should be achieved by asking users to report their depression symptoms and then don't suggest any activities that exceed their competence and self-efficacy. At the same time, users really appreciate the ability to customize the apps. The most valued type of customization was creating to-do list and manually logging completed activities, which is basically this little app that asks you to create a checklist and then check things off. So these activities were considered super intuitive, low burden, and pleasurable. Our participants said that checking things off is extremely satisfying, and this could enhance the user's sense of autonomy and their self-competence, and also relate to their own values. According to the self-determination theory, autonomy, competence, and relatedness are three basic human psychological needs and can enhance well-being and satisfaction. Another helpful customization feature is to annotate passively tracked data. For example, if a user forgets to bring their phone with them someday, the system should allow them to annotate data and manually log their activities. And this could complement algorithmic suggestions when they fall short. In a nutshell, mental health technologies will reach its full potential by combining machine intelligence with human intelligence. And our research highlights that customization is an important way to augment user autonomy, but it shouldn't exceed users' cognitive and mental capacities.